And this is a common scenario, sir. Normally, elderly people at home may have chest pain. So, what can be done when we have chest pain? So, again, in Indian settings, they will give some water. They will make them to drink water and sit and call for ambulance. Before ambulance comes, is there anything can be done?
Yes. So that's a very excellent scenario what you said. Chest pain, the most commonest symptom. It's called a symptom. That's because the patient perceives the pain. That's why it's called a symptom. It's a chest pain, which is very common we see in emergencies. So why do chest pains occur? Okay, so this is the chest, right? We all know this is the chest. Okay, chest has many organs from outside to inside. I'll just mention from outside. Outside you have a skin, you have muscles, fascia, tendons, you have rib cage, sternum, ribs, and cartilage which is attaching to them, and inside that you have pleura, lungs, inside that you have pericardium, heart, and below that you have a windpipe and then a foot pipe, that is esophagus, and behind that you have some other nerves and blood vessels and other things, and then you have a spine, and then you have a skin at the back. So this many organs are there in sequence. So you have a diaphragm, which is the biggest muscle in the body, which is separating your chest from the abdomen. So that's a big dome which is covering like this. And once you come to the abdomen part, is near the chest area, we have a liver, you have a gallbladder, you have a pancreas, you have a spleen. So, and you have intestine below that.
Right.
Literally, all the major organs are here in the chest. So, wherever you have any issue, the symptom you perceive is a chest pain. You understand?
Right.
So, that's why I told you this is the commonest symptom, which is a chest pain. Okay. So, how do you differentiate between a heart pain and a chest pain? Now, you know the difference when I use heart pain and a chest pain. Okay, heart pains are usually very severe, sir. Very severe. It's like 10 out of 10 pain score. Like pain score is how we assess. So if 0 is no pain, 10 is the most severe pain. So what is your perception of score out of 10 is called a pain score. So when we assess a pain, we always have to ask the patient what is your pain score. You have to teach him many ways. Like, you can tell 0 to 10, or you can tell this much to this much, or you can tell height wise, or you can tell severity, like open your finger. So as long as the patient understands what your question is, he should be able to tell you how much pain he has at that particular.
Normally, it can be easy
pain.
Yeah.
Yes.
What is the rate of the
rate of the pain? Yes, exactly.
1 to 5.
1 to 5. Even that you can ask. Very simple. Or you can just tell him 100 rupees. How many rupees of pain you have? That it's easy. But illiterates usually understand in this way. Literates usually they understand 0 to 10 scale, they'll understand. So mainly the purpose of this point is like you need to ask them what is the severity of the pain. First thing, is it a sudden onset or a slow onset? Was there few days before now, whether he was suffering with less pain, now it has become more. And then third one, is it radiating anywhere? What do you mean by radiation? That means all our nerves which are originating from our brain and spinal cord, they give distribution. They have different nerve endings which supply to different organs. So when one particular nerve organ is perceiving pain, it can radiate the pain to other nerve endings. That's why a pain, heart pain which you are having here can go to jaw, can go to left shoulder, can go to the left hand in the medial part, inner side of the left hand, can go to back. Sometimes it can go to right shoulder and right inside of the hand. So this is called radiation. So when you have a radiation, it is significant.
Okay.
It is significant. Okay, so you have onset, sudden or slow, you have a severity, and you have a location where exactly it is, and you know where it is radiating. And again you should ask, does it subside? Is it a repeated pain or the first time pain? Sometimes if it is repeated pain, they will know, okay, this is the same pain which I got as a heart pain. This is the first time. Okay, first time, did it come down any time? Did you take any medication? Is it increasing on exertion? Like, walking it increases, running it increases, sitting it subsides. So these are the main history you have to take. It will help us in differentiating classic heart pain versus a non-classic chest pain. Okay. So once you feel that it is a classic heart pain, yes, that means you are dealing with a heart attack right now. Don't take any other suggestion to any other diagnosis into the mind. You need to take him to the hospital right away. So most of the people waste their time in taking to nearby smaller clinics where they don't have advanced, either not even ECG. So don't waste your time in taking a place where they don't have ECG or they don't have a person who can diagnose an ECG. Okay, so go always to a place where at least where they can get an ECG and they can be able to confidently tell, okay, this is not a heart attack for you. Okay, so most of the times what ECG what we do is a 2D search, like means it's a time now. How is your heart now is what the ECG tells. So sometimes we will require you to take ECG at a frequent intervals like a half an hour time or 40 minutes time, 1 hour time. So we will give you some medicine and then we'll let you stay there for half an hour to 2 hours. We'll do serial ECGs and we'll see any significant dynamic changes in the ECG.
Okay.
So when we see the dynamic changes, even now if the heart is normal, after half an hour if it is not normal, we'll immediately know that it is heart attack.
Right.
So when you are having this particular heart attack, it is very important for you to reach a hospital, a cardiologist, a cath lab, where they can do an angiogram, emergency angiogram, and they can see which of your blood vessel is obstructed in your heart and they can open it up. That is the best treatment possible for a heart attack.
Right.
Okay. And then sometimes at night, cardiologist is not available, but you are in the hospital. Sometimes they can give you a medicine which dissolves the clot.
Okay.
It is also an equally good alternative. So don't argue with them that no, I came for a stent, you have to put me a stent. No, it's not like that, sir. If the time permits, they will give a medicine which will dissolve the clot that is equally effective in the first 6 hours of your heart attack, equal to putting a stent. Okay. So this is what they do in the hospital. So what your question was, what can I do at home to prevent this? Yes, sir. Heart attacks, what happens when the heart attack is, there is some cholesterol which is there in the blood vessel. So what it causes is it decreases the blood flow. Correct?
Right.
There is a road. You have parked your car beside the road which is coming onto the road. Now what will happen to the traffic? It slows.
Right.
Correct? It slows. Like you, one other person has parked another car behind you, another car behind you. What happens? It becomes a traffic jam.
Yeah.
That means blood also, it is going freely, there is some obstruction, it slows down. Once it slows down, whatever happens, the blood cells which are there, they start clumping together. Then they become a clot. Once it becomes a big enough clot, they will completely obstruct the blood vessel and you have a traffic jam. That is when you don't get a blood supply distal to the clot, and that is when your heart attack occurs. So this is what happens in a heart attack. So what you can do at home is you can give him aspirin.
Okay.
We call it as dissolvable in aspirin. It's called Disprin.
Okay.
So the Disprin 325 mg tablet can be taken. That means you can just put it in water, it will dissolve and drink it, or you can just put it in the tongue and it will dissolve in the mouth itself. When you do that, you prevent clotting.
Okay.
Clumping together.
Okay.
Okay, that's usually immediate effect it starts and it decreases the severity of the heart attack.
Okay.
Okay, so does everyone can take this tablet? No. Some people who are having active bleeding, that means they are already bleeding somewhere, are not supposed to take Disprin, sir. Okay. Any other alternative medicine? Usually there is no alternative to aspirin. But being said that the blood pressure is high, the pain is very high, what we tend to give them is nitroglycerin, sublingual nitroglycerin, what we give, sorbitrate. Usually 2.55 mg is what we give, but we put it under the tongue so that it will again swallow. What it does, it decreases the blood pressure and decreases the load on the heart.
Okay.
And then it decreases the symptom,
Okay.
heart pain symptom, but it doesn't prevent heart attack.
Okay.
As such, it doesn't cure, but it decreases the symptom because it decreases the load and decreases the symptom. Very precaution we have to take is, once you take this sorbitrate, you have to make the patient lie down on a flat surface. As I told you, because the blood pressure comes down, he will feel giddy and he will fall. That will be another complication to the patient. So when you are taking a sorbitrate, you have to be in a lying down position or recovery position if he wants.
Okay.
Okay, so this is the precautions you need to take. So these are the only two medicines we suggest them to take during a heart pain, but other medicines, they don't actually recommend it without a doctor's prescription or doctor's advice. So as I told, the minute you get a chest pain, think it is a heart pain, go to a professional, get an ECG done, see if it is not a heart pain. If they want advising you serial ECGs, get it done. Don't be in a hurry to go home or do anything. Get yourself evaluated and get done. Who will get more chest pains, sir? Who will get more heart pains? Smokers. The people who are drinking alcohol, the people who are having diabetes, hypertension, obese patients, the people who are having high cholesterol in their body. So these people are more tend to get heart attacks, along with the people who are having a family history. That means father, mother, brothers, sisters who are having a heart problem in their life at a young age, then you are prone to get at a young age. That is the reason we have healthy heart checks, regular intervals. Every year you can get your cholesterol and other things checked, ECG checked, 2D echo checked, meet with a cardiologist, and then have a healthy lifestyle. You can always prevent a chest pain.
Yeah, thank you, sir.